Hey,
Perfect.
welcome. Thanks
morning.
for joining us. Good morning. So today we're going to talk about bringing your data into actionable insights, actually making your data tactical. I'm Jessie Cardello, Director of the Account Operations Team, joined by...
Morning, I'm Rachel Roth, Account Executive. All right, so ready to get started. So leveraging healthcare data insights is an age-old challenge for health systems and payers. And Arcadia accelerates healthcare technology with data insights that help with improvements from a financial perspective and lead to more efficient care delivery. And so you might be wondering, okay, I've aggregated my data, and so now what? So we're going to take the next couple of minutes to demonstrate some of Arcadia's tools and look through it from the lens of the patient cycle.
Great.
And really dive into how that looks on the Arcadia platform.
So like Rachel mentioned, we're going to talk about that 360 closed loop process for a patient. So this is really about patient care. So before the patient even gets involved, we have some really fantastic Vista analytics. These analytics are going to give a health system insight into how their network's performing, how healthy their patients are, where their patients are in need. And the insights are very visually digestible. So you're going to know exactly what action needs to take place in order to engage with your patients. This isn't just a grid, a big list of patients. You're going to really understand the health of your network, the state of the state. So once you've identified through your analytics what patients really need some outreach, this is when we deploy our Patient Engage product. This is where patients can get informed if they're due for a COVID shot, a flu shot, annual wellness visit, if they have important tests, lab tests that need to be taken. We're engaging the patient into their own care. And then the last step is once the patient has scheduled that appointment, that we have some tools for the front office staff to actually plan their week, plan their morning. Who are we seeing today? What gaps do we need to close? What is that punch list that we have for the patient to make sure that their visit is actually closing some gaps? So these pre-visit tools are pretty critical to understand how can I make sure my patient leaves this office getting the best care that they need.
So now looking at it from a point of care perspective, the patient really wouldn't have a lot of activity here other than participating in the visit, right, with the provider and answering the questions, which then the data would be leveraged further downstream from. But starting at the physician standpoint and looking at it from their side of things, we have our Inform desktop application, which is it's a zero-click tool that pops up within the EMR that then effectively prompts the physician to act on those gaps that need to be addressed with the patient in real time. Next, you'll see our quality performance team member. So you'll see that we have many different Vista dashboards that the quality team members have access to. This is just a view of one of them. But it lets them drill into the patient level to really address and view where those gaps are that need to be addressed.
And the most exciting part of this closed loop cycle is the post-visit. So the patient doesn't have any action. They're celebrating. They actually engaged in their health care. They were engaged with. They understand what gaps need to be closed. They visited their physician. The physician sort of led, like Rachel had mentioned, using our desktop tool. What's that punch list? Do we address all those things? Do we follow up with some next steps of other appointments that need to be made? So now the physician gets to get a report card of sorts, which we call Vista Push. This is going to give them insights not only into, like, did we close that gap with that patient? How is my panel of patients doing? But they can see some other critical information, cost and utilization information. It's really giving them a state of the state. How am I performing in my network? How are my patients, how healthy are they? Or do they have needs that need to be met? And then the last step is back at the health system or at the plan that we have a tool called Assess. And the really cool thing about this interactive tool is that while we're waiting for that claim to take that 30 to 60 day life cycle lagged information to make it back, that event data that the physician collected during the point of care is pretty instantaneously in Arcadia. So they can close those gaps, make sure that the payer is aware that we did our job. We're reaching out to patients. They're getting good care. And then the cycle starts all over again. So all of that information that was recorded during the visit is then in the system, and we start that cycle all over again to make sure the patients are getting the best care that they need.